Hey Fundis, welcome to another excerpt of Funda Chat. Today we've got Monique Kok with us. She's a clinical psychologist, and she's going to be talking to us about claimants, and specifically claimants with neurological problems or neurological damage, brain damage, for lack of better terms, and how we as people and even clinical practitioners should be treating these claimants when they enter our premises. Welcome, Monique.
Thank you.
Thanks for joining us.
Thank you for having me.
I'm looking forward to hearing how we can better help and serve these claimants. So, Monique, you obviously approached me about this, so you feel very passionate about it. And so give us a little bit of background, what you've experienced with these claimants, and possibly where people should have a look at how they treat them, and what have you seen that invoked this?
Of course, thank you. I think years and years of in practice with specifically brain-injured individuals, people who've suffered traumatic brain injuries, you start to learn that I think what they find very difficult is that their difficulties are often invisible. People don't know what their problems are or what their difficulties are. So unlike somebody who comes in a wheelchair, we are able to anticipate what they need. We can help them open a door, we can help them carry a coffee. But for a person who's suffered a traumatic brain injury, generally people don't understand their difficulties. And so I think over the years I've come to often see how perhaps they're mismanaged to a degree, misunderstood a lot of the time, and it causes a lot of conflict in every situation that they find themselves in. They'll come into the practice, there'll be conflict, they'll go into social situations, there's conflict, because people don't understand why the behavior is that they're exhibiting is there and how to manage that kind of behavior. So oftentimes in this context, miscommunications, lack of communication with the claimants, and we have huge explosions with these injured patients, not because they're bad people or because they can even help it, but it's just because of the nature of the injury that results in this kind of expression of a behavior. So I've had a lot of empathy for them over the years, and so I do feel passionate about the way that they are treated, the way that we treat them, with empathy and care. But I do think we need to understand better where it comes from and what it looks like in order for us to manage them better.
Because each person obviously displays their injury in a different way. Because I, for example, have assisted with a few assessments, just as a calming mechanism for the person that's there. And I, for example, assisted last year with a claimant. In the morning, when him and I were chatting, he was fine, he was cognitive, we had a great conversation, had breakfast together, and then later in the afternoon, the ladies called me, and he was a new person. It's like a brand new personality came, but it's because he was there the whole day, and the stress invoked a dementia type presentation, yes. And so each person displays these injuries differently.
Absolutely, and it's really hard to know what combination of injuries you're going to see. So every person is different, and that's because of the nature of every brain injury. It's in the same as if you dropped your cell phone. You don't know what's going to happen, what problem's going to come. And if I drop my phone and you drop your phone, the difficulties we're going to have with the phones might look different, but it was the same drop. And the brain is very complex, and how the brain interacts and is integrated. So every injury looks different, and every patient presents differently. So it's hard to say, yes, always, whenever you see this, it means it's a brain-injured person who's struggling. That's not the truth. Because oftentimes, regular people who are not brain-injured may have similar difficulties. It doesn't mean that they are brain-injured because they behave in a certain way. So yes, every person, and in your instance, that patient's definitely fatigue, stress, being overwhelmed. Their brains can't process information the way that an uninjured person's brain does. And so all of those things contribute to a behavioral expression of something that is not always manageable. So, and not everybody knows how to manage a patient who's suddenly irate or shouting and irritable or withdrawn or confused, and they don't always know what's going on, and it really is just related to how that person's brain is processing the environment at that point.
So how should we approach somebody like that? If I'm now, we'll start with hospitality.
Yeah.
These lovely people downstairs that are basically looking after that person for the day. They like their mother hen of the den. And, so let's start with them. How should they help these people?
So I think it's important to understand brain injuries. Their difficulties are invisible, so we don't know all the time. And so the reason that we need to firstly manage them properly is because how they are received in the morning. So when you sat with that patient that day, it was calm, you kept him calm, and that is conducive for testing. So I'll use myself, who does the neuropsych assessments. If he comes to me and he's completely in distress, it's going to affect my results. So keeping them calm and keeping them in a state that sort of just is settled helps the rest of the assessment process. So the hospitality ladies have the most difficult job because they're with them all day. So they've got to manage every patient and all the difficulties that they face. And so I think, the beginning point is to understand that the patients present differently, as we've said. It's cognitive difficulties, and there's emotional difficulties, and there's social difficulties. So understanding that cognitive difficulties may be things like not being able to sustain their attention for a very long time, not being able to recall information, not being able to even showing up for the appointment at the right time at the right place. Those things are difficult. Feeling overwhelmed by the environment, feeling overwhelmed by too much stimulation coming from the environment. They may have difficulty even just finding their way around buildings. I've lost patients in buildings. They've gone out for a smoke, and half an hour later we can't find them because they are unable to manage their environment. Also understanding that they can't manage their emotions a lot of the time. Not everybody, but some of them cannot manage their emotions. And that means you will have patients who appear rude, patients who seem irritable, intolerant, I don't want to be here. Some patients will say, I can't sit here, and it will look like they're in some way biased to the environment that they're in, but really it is a noise control thing. They can't process the information that's coming at them at that time. So they will ask to go sit somewhere else where it's quiet. Or times patients that are just completely withdrawn and they look uninterested, they don't want to be here. That is also an apathy. It's part of brain injury. And then we have the dramatic ones who are crying 1 minute and then they're fighting the next minute. And so all of those things make it very difficult for the hospitality ladies in particular, because they may have had a calm patient in the beginning and suddenly 2 hours later, this person is irate, difficult to manage, shouting, emailing lawyers, phoning people, complaining. And so I think what's important is to see the small, subtle signs of when people start tapping their feet. We had one guy pacing up and down, and immediately I would say, ladies, I think that gentleman's not doing okay. Just check in with him and make sure that he's okay. So being able to identify what it is when a brain-injured patient is not doing okay is very important. You will see that they will perhaps ask you to repeat your questions a lot because you've asked them, what's your father's name, age, highest level of education, and job? He only heard what's your father's name. And so there's a lot of repetition. And so you start realizing this person needs me to slow down. This person needs me to break the information into smaller bits so that their brain can process it. Or this person looks agitated, and you would say, you would use empathetic language, and you would approach them empathetically to say, how can I help you? What can I do to make you comfortable? I can see that you look uncomfortable. How can I assist you? I think a lot of times we take things personally and we think, oh, I haven't done a good job, so this person's irritated, they crossed with me. And that's the last thing that we should do in order to manage them better. We should be calm, and the hospitality staff are great at that. It just gets very overwhelming when you have a whole waiting room full of brain-injured patients. And so it really is, for them in particular, remaining calm, identifying when patients aren't okay, not taking rudeness personally. They have no breaks at times, brain-injured persons, and they will say the most inappropriate things, whether it's racist, whether it's sexual, whether it's just completely misplaced. It happens, and we can't take those things personally, and it's just to gently say, I can see you're not doing well right now, how can I assist you? And just maintain a calm, empathetic environment.
Would something like a repetitive task, for example, regularly going around to each person asking, would you like something to drink? Would you like to take a walk? Stuff like that. Would that help also just keep people like that calm?
I think, again, it's a very difficult question because some people might get irritated by the repetitiveness, and go, why you keep asking me, I'm okay, because they're irritable already. So I think it's really being able to look at each patient and identify those triggers. So if you see somebody's tapping their foot or they shifting in their chair a lot, are they in pain or are they irritable? Are they snapping at people? So identifying who is irritable and saying, is there anything I can do? Would you like to sit in a quieter place? We've got a beautiful canteen. You're welcome to go sit there while you wait. And for other patients, it really is checking in and saying, are you okay? Especially the ones who look like they're not here. Are you okay? Is there something I can get for you? And just constantly communicating to say, we are here to help you. Please communicate your needs to us. Please let us know what it is that you need. So if you create a safe space where they feel comfortable enough to come and say, I really need help with 1, 2, and 3, or I'm confused right now, I don't know where I'm supposed to be because I was told to go to X-ray and I was told to go to the ortho and I really actually don't know. They don't want to feel stupid. And if they find that I'm confused, that makes them look stupid. So they're not going to tell you they're confused.
Yes.
And so sometimes it's also slowing down the process and saying, please sit here, you're going to go to X-rays. Don't tell them anything else. You're going to go to X-rays. Having said that though, I do think it's important that we manage the expectations. Every single patient I see, I run through the process to say, firstly, you're going to be here for at least 3 hours. And then I get, oh, I wasn't told that. And that's, they need to know what's going on in the environment in order for them to manage themselves. So just communicating, you're going to be here the entire day. You're going to see 5 experts today, which means it's going to be a long day. I'm very sorry for that. Reflecting. It's going to be really tough. Please let me know. If they know that up front, if they've been sitting waiting for an hour because the neurosurgeon actually got stuck in surgery and is on his way here but is not quite here yet, at least they know what's going on. So I run through my entire process with every single patient. I say something like, every single time I say, I want you to understand why every expert keeps asking you the same questions, because that in itself can be frustrating for them. I've had patients say, why do you keep asking me these things? The person before you just asked me that, but because they don't know. So explaining the process to them, helping them understand how long it's going to take. A neuropsych assessment takes at least 3 hours. And in those 3 hours, we're going to do this. We're going to speak about history. The reason we speak about history is so I can understand who you were before the accident. That helps me better understand you after the accident. And then they settle because I've now explained to them they can manage their expectations. So even the hospitality ladies to say, you're here to see 5 people today. That's a lot of people. So please be patient with us. The doctors are in and out. We're moving patients around so that we can get everybody in, and you might wait for a little while, but if there's anything I can do for you, please let me know. So really just meeting each person where they're at.
That makes sense. So, and Monique, just in closing, any last thoughts that you'd like to leave with either our team downstairs or with your colleagues?
Yes, I think it's really not an easy thing sometimes to deal with patients who are brain injured. And again, it's just, for me, it's patience and empathy. And not even just brain injured patients. Everybody, we should be treating everybody with patience and empathy. A lot of patients who don't have brain injuries but have chronic pain will present similarly because they're irritable. It's cold right now. They had to get up at 5 o'clock this morning to come to an assessment 3 hours away from their house. They're in pain, they're annoyed, they get here, they're sitting here for 3 hours before they get to see anybody. And so I think it really is for everybody, whether they're brain injured or not, is communicating love and empathy, understanding that everybody processes things at a different rate. Our brain injured people really struggle. The other thing that's also quite significant for me is language. I think sometimes I annoy some of the attorneys because I insist on having interpreters, and if we need to find someone who comes from, I think recently we had an Ethiopian patient, it was really difficult to find someone. But when a person has a brain injury, already verbal expression and understanding language can be difficult. Now expect them to come and speak to me in a language that is not their first home language. They're probably thinking in another language, and I'm expecting them to express what their mood is like, or express how the accident has affected their social functioning in a language that they're not even thinking in.
Yes.
So language for me is very important. Ensuring that the person is able to express themselves in their home language is point number one for me. The other thing is breaking things up into smaller bits. Take it slow. Yes, we're pressed. Yes, sometimes we see a lot of patients, and I get that, and it's just the nature of the work that we do. But sometimes patients need 2-3 breaks if they're brain injured, because they're getting tired. And the more tired they get, the less we're getting out of them. So what are we doing then, actually? We're not really practicing ethically, and we're not offering them the fairest opportunity to express the difficulties that they're experiencing. So really make sure they're taking lots of breaks, break the information up into smaller bits. Don't get irritated with them if they can't remember their mother's age, or if they can't remember what's the name of their primary school. Or I like to draw pictures with them. A lot of the times I'll say, okay, let's just recap that timeline, because something's not adding up. You said you didn't fail any grades, however, you matriculated when you were 25. So let's just, I'm exaggerating, but let's just take a step back. Here's our timeline. Let's go through this one step at a time. Just slow it down. I think, especially for brain injured patients, we tend to get on this train in this industry, and we push, but they can't always keep up with us. And we really have to slow it down, have empathy for them. Kindness goes a very long way, respect goes a very long way. And just remember that brain injured or not brain injured, they have difficulties, and we need to just be kind.
Definitely. Thank you so much, Monique. That was very informative, and I'm sure it's going to help the Funda family and our colleagues in the industry. And I really appreciate your time. Thank you so much.
Thank you for having me.
Thank you, everybody, for joining us this week and for this episode. I hope it was as informative for you as it was for me. Please like, subscribe, and share so that we can get this information to as many people as possible. Thank you.